take a moment and talk a little bit first about why it's lower cost, where the cost advantages are, and then why it's higher quality, if you would.
Yeah, I mean, those are generic questions, so there's probably lots of places where it's not. So, you really have to look at it individually. I think really what I'm saying is that virtual healthcare is an enabling technology. People have to use it wisely. They have to use it as part of their programs. They need to think about how to best leverage the value out of the technology and not use it in ways that are inappropriate, because then it's not going to do those things. So generically, what we're trying to find are those places where we improve quality and reduce cost at the same time. Those are the things that send off little rockets and say, that's the place to invest.
What's the source of improved quality?
Well, again, it depends on the application. But, you can imagine that in this country, for example, in any country, we have challenges really having very clearly evidence-based guidelines, interventions that should happen. We have trouble getting the whole population to actually do that, right? So one example is, diabetes. Huge problem in Ontario. 1 million people or more who are diabetics. And when you look at the numbers, they're not all having the required interventions. If you look at what they need to have, eye exams in order to detect retinopathy and prevent blindness, there's various screening tests. People are not having those done as much as you'd think. So retinopathy, for example, we think that somewhere near a third of folks are not having the screening done at appropriate times. So if we can use technology, and that's exactly what we do here, we can use technology to take those pictures of their eyes wherever they happen to be and screen that, we're going to prevent some blindness. We're going to catch people earlier in that cycle.
The collaboration you're talking about, feedback amongst providers is going to happen a lot quicker. How will innovation develop over time? Look ahead for me.
Well, I'll tell you, the really exciting and fun part of what we do here is that it's really not about the technology per se, right? What we're really trying to do is stimulate people to think about what they do, to think about the processes of healthcare. And what technology does is it enables new processes. It enables innovation in the healthcare system. And that, I think, is really the bottom line of what we're trying to do here.
Well, Ed, thank you very much for taking the time today to talk to us about Ontario Telemedicine Network, and it's so impressive to see what OTN has done for Ontario and to create a leadership position for Ontario in the world. Thanks for the time today.
Thanks for having me.